Well, from flu to COVID to pink eye, there's a good probability at least one of these ailments is affecting someone you know and love. And this warm weather is not correlating with a cool down of sickness. We've invited Dr. Suresh Nagappan back to join us. He's the Cone Health Children's Medical Director, and you are busy right now.
We are. So this feels like the winter that's not ending. We're just viruses and strep throat and everything. It's just going on and on.
Well, let's look at flu data first. The State Health Department's flu report shows this is the worst flu season since 2017, with more flu deaths than the last 3 seasons combined. 2 children died of the flu the first week of March, bringing the total pediatric deaths this season to 14. Why is this flu season particularly bad for children?
We don't know for sure, but one theory is that during COVID, when people were masking, it blocked a lot of the flu. So our flu season in 2020 and 2021 and 22 was actually not bad. And now it's kind of coming back with a vengeance. Now as things have opened up, a lot of the flu is now spreading, and so now we've had one of the worst seasons we've had in several years.
So this could be a baseline flu season, just more people are getting sick because
That's right.
of the reduced regulations. So this summer when you were here, you mentioned pink eye was starting to surface. Now nearly a year later, you're still seeing it. Explain the continued contagion.
Yeah, so pink eye, unlike some of the other things that we talk about, it's not that seasonal. So sometimes it just goes on and on and on. And that's what we're seeing this year. We're just seeing lots of pink eye. The thing about pink eye, it's really contagious. So someone rubs their eyes and then touches something, and then you touch that thing. And so you can imagine in a daycare or a preschool how easy it is to spread. So my advice is wash your hands. That is the key. That is really the way to block this spread.
Okay, and you said if you don't normally have allergies, there is probably something going on and you should see a doctor.
Yeah, so if your eyes are suddenly red and you've never had allergies before, think about pink eye.
Okay. Well, the COVID response is evolving. I want to talk about that. As of March 1st, the CDC updated those guidelines to more similarly mirror the flu. 24 hours fever-free, good to go back to work or school. As parents, how can we protect our little ones when they're going to school with children who potentially are still contagious with COVID?
Yeah, so this is good news in a lot of ways. This means that COVID is less severe than it has been this year. In the hospital, we're seeing far less COVID patients than we've had in any year in the past. So that's all good news. But of course, parents still want to protect their kids. And the vaccine is the best way to do it. Vaccines for kids still work. It still helps prevent serious illness. It doesn't prevent every COVID illness, but it prevents you from going to the hospital. And that's what we're really talking about.
Does it work like the flu shot for kids, where even if you get this virus, it will be perhaps less severe?
That's exactly right. So what I recommend is both COVID and flu. That's your best line of defense against those viruses.
Dr. Nagappan, thank you so much.
You're welcome.
We can only hope that there will be an end to this sick season soon.